All right. So I guess the easiest way to start is to just kind of go around to everybody. You can introduce yourself, your camp, and kind of what your plan for the summer is. So I'll start. I'm taking off my COCA hat and I'm putting on my Happiness is Camping hat. So my name is Ryan. I'm also the camp director at Happiness is Camping in New Jersey. And we are running a long weekend of family camp and five-day sessions of overnight camp as well. So I'm going to pass it to the first person on my screen, which is Gail.
Hi, I'm Gail. I'm with Camp Circle of Friends in Saskatchewan, Canada. And right now we really just have put together a proposal to put forward to the oncology team or medical team to see if we are going to move forward and what would that look like. The proposal that we're looking at would be to do a much smaller camp. So we would do a graduating camp, those that missed the opportunity to graduate, and then some teens as well. So it would only be probably 20 campers or so with just a handful of medical staff, because none of those particular individuals would be high risk or on treatment at the time. So we're in a whole pattern at the moment.
Great. Okay, and I'll just keep popcorning around. Let's go to David at Arizona Camp Sunrise.
Good evening, everyone. David Stempley with Arizona Camp Sunrise, and we are planning on doing in-person overnight residential camps, 2 6-day camps this summer, one for the siblings of our survivors and then one for our survivors. And we are planning on doing it with either children who are more than a year out of treatment or on maintenance treatment, but no one in actual treatment for this coming summer anyway. So that's kind of our plan moving forward.
Great. Okay, thank you. Let's go to Rich.
All right, Rich Brundage with Camp Kids Against Chicago and Camp H-Town. Both camps are planning on being in person for a week, and we have been adding this past year, we added a family retreat weekend, and I think we just kind of got the thumbs up to do another one for Chicago. So that's happening towards the end of the year.
Great. Let's go out to Dream Day on Cape Cod there.
Hi, I'm Julianne. I'm with Dream Day on Cape Cod, and we operate a family-style overnight camp that operates from Sunday to Friday mornings. And we sort of have families that have their own living accommodations and staff have separate living accommodations. So it makes it a little easier for us.
Great. Okay, Katie at Good Times.
All right. We are going to do a family camp, 3 days, 2 nights. I'm with Camp Good Times at YMCA Camp Reed outside of Spokane, Washington. And our staff stay on site, but like Julianne, we have separate living quarters. Each family will kind of have their own cabin area. And then we'll push out, we have a little bit of virtual content that we're going to continue, not like we've done in the last couple of summers, but kind of just a little bit of virtual content to catch some of those kids that wouldn't be able to come out at all.
Awesome. Okay, Erin.
Hey everyone, I'm Erin with Camp Rise Above in Charleston, South Carolina. We serve kids with cancer, but also a whole bunch of other populations. And our plan is 2 4-night overnight camps, 2 2-day camps. So like short little day camp sessions, and then a young adult weekend as well, which is going to be 3 nights. So this will be programmatically the most diverse and biggest summer we've really ever had. So, but we were able to do in-person programs last year because some of our campers aren't as compromised as others. So yeah, that's where we stand now.
Great. Okay, I see another Arizona Camp Sunrise. So Ashley, if you just want to introduce yourself and tell us your position there.
Yeah, I won't repeat everything. My name is Ashley. I am the executive director of Southwest Kids Cancer Foundation, which operates Arizona Camp Sunrise and Sidekicks. And as David said, we're doing 2 5-day weeks for siblings and survivors.
Great. Okay. Bernard.
Hi, folks. Bernard Mauricia, call me Bernie. I'm CEO of Oncology and Kids. We're at Camp Reach for the Sky out here in San Diego, California. We'll be going back to our 3-week-long camps during the summer. So a day camp, a 6-day day camp, and then 2 overnight 6-day camps. In Julian, we'll be doing a teen weekend, hopefully in May, and then a family/bereavement camp in November. And then we'll keep the component of our virtual camp as well, but most likely a sort of a weekendish time frame. And that's how we're looking so far.
Awesome. Okay, Cindy, Ronald McDonald.
Hi, I'm Cindy from Ronald McDonald out of Philadelphia. We are going to expand our programming. We're usually a 1-week residential camp. So this year we'll do the 1 week for the first time in 2 years. And we're also going to run a virtual 1-week camp in July. So our in-person camp runs in August. And we're going to drop our enrollment in about half for in-person and see how it goes, and offer virtual to our active treatment kids and anyone who doesn't make it into in-person. So our applications just went online today, so should be an interesting ride.
Oh, great. Good luck with those applications, Cindy. Kristen.
Hi, I'm Kristen from Camp Casco out in New England. We are also going to be doing the most programming we've done, which is exciting and nerve-wracking. We're doing a 5-day day camp. We've got our week-long overnight camp. We are finally launching our sibling weekend that was supposed to launch in 2020. So we're finally getting that off the ground. And then we are doing 2 single-day, like 8 to 8 camp programs.
Awesome. Thank you. And Jason?
Hey guys, Jason Kirkland with Camp Rising Sun in Mississippi. We are doing a 5-night camp this year. Again, it's we missed 2 years. We did a virtual camp in 2020 and then skipped last year. So we're headed back into a camping program this year, and kind of excited because we're moving to a bigger campground so we can have more campers. So we're excited to see the return to camp this year.
Excellent. All right. Let's I see Zoe. Zoe, if you just want to tell us your position at camp.
Sure. I will be the senior camp program director, so the program director for our senior camp at Ronald McDonald Camp. So just like Cindy said, hoping to do a virtual and in-person camp. So excited to be here.
Excellent. All right. So I guess before we dive into any specific topics, did anybody come in tonight and say there's one thing that I need to talk about tonight, whether it's vaccination, cohorting, programming, certain policies? Did anybody have any specific questions that they wanted to ask the group? Go ahead. Go ahead, David. You guys can just unmute yourselves whenever you feel like it.
And I will say, I forgot to say my position earlier. I'm the brand new camp director for Arizona Camp Sunrise as of February 1st. So
welcome.
Looking for a lot of the guidance on some things. I'm just kind of curious if anybody else is going through or is accredited through ACA, COCA, any of those types of things. Is anybody having to go through accreditation this year?
We're having a visit this year for ACA.
Okay.
We've been accredited, but yeah, it happened to fall this year when we're going back in. So
we are as well, and our entire leadership team has turned over in the last 3 or 4 months. So we have no one going through this who's done it before. So.
Oh wow. Well, we're here if you want some help. We're happy to help.
Excellent. That's what I'm looking for. So. All right, perfect. Thank you. I won't take up any more time.
Yeah, David, we're at Happiness is Camping. We're also ACA accredited, and You can see my lovely hotel room behind me. Me and Rich and Eliza, we're all at the Tri-State Conference right now for ACA in Atlantic City. So
Excellent.
very cool. We just got back from dinner. So,
Nice.
so let's talk, since that's been a hot topic item here. Vaccinations. What's everyone thinking? Is everyone planning on requiring them, not requiring them from staff, but not for kids? So I'll just start off at Happiness is Camping. We are requiring it for everyone this year. Last year was only staff, but it's for kids and everyone that comes on camp this year.
We're going to require it, but say that, if you do have a medical waiver, please submit it, because we do have already a handful of children who have, mitochondrial disease who cannot get any of the vaccines so far, or have had an adverse reaction to one and can't get more. So we're kind of saying you're required to be vaccinated, but there's an outlet, but it needs to be approved by your doctor, sort of thing.
Yeah, we're along those same lines. Our medical staff is all in on, so for volunteers, fully vaccinated. For the campers, we're really sort of pushing the fact that, hey, we'd like everyone to be vaccinated. If you have an exemption, you need to speak to our medical staff and make sure that we go through every single step, and they will make the determination whether that fits or whether it doesn't.
Yeah, we're requiring it of all of our staff as well. No ifs, ands, or buts.
Yeah, same for our staff. We're waiting on some guidelines from the state regarding campers, and also I'm part of the YMCA, so we're navigating those two larger organizations till we know a little bit more about campers, but we'll likely do some testing component prior to camp for everybody. We're just waiting to, Washington State is a little slow, so we're waiting.
And I'd really love to know what everybody is doing for testing. And we're trying to kind of navigate that right now, like possibly doing testing as they get there, like in the car. And then once it comes back negative, then we let them in. And then do we just do testing as needed? And like, where are you guys getting tests? What are your protocols looking like? That's just kind of seems like a big, we didn't do anything like that, obviously, last year. So I'm kind of in the weeds about that.
I'll share that we basically talked to the same people that Ryan brought to his camp here at ACA Tri-State for the testing thing. So we're actually trying to figure that out, because our camp's a little different. We don't have the ability to bubble and stay on site. Our camp happens in the city at a hotel in Chicago and in Houston. And so we will be spending probably most of our time indoors as we rotate through and keeping our like little safety net. The current plan, as we told people, is the exact wording is, we took this from another COCA camp, requiring all participants, campers, and staff to have up-to-date vaccination status before attending camp, which means boosters as well, if you're available. That was like the proper language to use. We're also asking every member of the household to get a PCR before they drop them off, so that we know that the whole house is cleared. And then we'll probably going to have a rapid test there when they drop off. And just the kids are getting out of like the whole caravan that everyone's been talking about that worked really well for drop off. And we're trying to figure out if we're going to be doing, rapid test or rapid PCR test every day when we come back from an excursion, just to keep it going. So we don't know, but that's the plan right now.
Who are you guys, Rich, using to get those tests from? Like, where are you getting those tests?
I'll let Ryan explain his company that because they were here, and they may even come to COCA-Con as a vendor, but we were reaching out to a couple different people. Yeah. The Chicago Police and Fire Department actually has a resource that they use for all of their people. So if you talk to their municipalities, maybe they'll have a good one for you. So they resourced that information out to us. And one of the hospitals that we worked with also sent some information our way on like, hey, here's who we've used. So there's plenty of third parties, and as long as our medical team doesn't have to stick their fingers up at kids' noses, it'll be nice.
Yeah, agreed. Thank you.
Yeah,
We're finding
so
just the opposite of that. So since we're such a small camp, we can't exactly afford an organization to come in and do our testing. So we're going the route of buying Binax tests online from Walmart. You can buy 12 boxes at once and just keep ordering and ordering until we hit that 250, 300 that we might need, because we're a little bit smaller than probably some of your organizations. But we were finding that $7,000 wasn't worth it. So we're just going to use our nurse on staff and any other people that have the medical knowledge to do COVID testing.
So
We're
first of all,
actually-
Jason, your puppy is adorable. I see that down there. So we used, just to piggyback off what Rich said, we knew them as Diligent Urgent Care, but their parent company is called Verdi MD, and I think I put it in the chat there. And they are national. So what they do is they basically work with a lot of urgent cares all over the country to give out those tests. And they charged us a flat fee last year of $1,000. And that $1,000, we could have got one test with it. We could have got 50,000 tests with it. It was just a flat fee. And so we did, I want to say we gave out over 500 tests last year with that flat $1,000. And then they also gave us boxes and boxes of Binax tests that we had probably 300 here over the winter. That obviously came helpful during Omicron. But basically what happens is the campers submit their insurance to Diligent. And if they don't have health insurance, then Diligent applies for Medicare on behalf of the kids. And and then they just have a quick telemedicine visit, which is literally, what's your name? Why do you need a COVID test? Because I'm going to camp. Okay, great. I prescribe you a COVID test. And by doing that telemedicine visit, their test is covered. And so the kids never had to pay anything. We only ever had to pay for the $1,000. And I think now that they've been doing it a lot longer, I think you'll be able to talk them down even on that $1,000. Because the government, through the CARES Act, is paying them for all of these tests, essentially. And they do PCR, they do Binax. They came and did rapid tests on arrival last year. And they also did PCR for us on day 5 of each session last year. And we got the results for everybody back the next day. So if you want it out of your hands and your medical team completely out of it, then I suggest looking for one of these companies, because they've all been working with schools all year long. So their systems are way better than they were last year even.
For those of us who are actually going to be in the middle of the woods, about an hour and a half away from anybody, our plan for this year is to have families do a screening for their kids a week beforehand, a 72-hour prior to camp arrival PCR test. They'll need to bring their negative results with. We're actually having all of our families drop their children off at camp. So it's going to be a little bit of a drive for them rather than busing everyone up. When they arrive, we will have them do a rapid test when they arrive, and sit in their cars for 15 minutes till they get the results back. And then if it's negative, obviously, then we check them in with our medical staff there, and then hopefully being able to do a rapid test again midweek, so that we can even ease back a little further or catch things before they actually happen. And Ashley's done a great job. For those of you who are looking for tests and whatnot, she reached out to our local county health department, and they gave us a boatload of PPE as well as 300 rapid tests. And so we're going to go around to all of our different county health departments and see what we can scrounge up.
Those are amazing suggestions. Thank you all so much. I appreciate it.
I tried that with my local one and they kind of told me to jump in a lake.
So we're kind of unique and we serve all of Arizona. So we have northern Tucson, kind of the whole spectrum. And our camp is in an even different part of the state also. So we've just kind of hit every area that we take kids from and said, hey, this is what we're doing. And most of them have been super compliant and said, yes, take what you need. Some they have extra hoops to jump through. And with the rapid tests, it's a little bit easier versus the 72-hour PCR. You have to have certain paperwork and different things to kind of appease them. But you know, for the most part, they've been really willing to help out. So it's definitely worth the ask if you guys haven't done that yet.
Great call. A quick question for those of you who use transportation. So I know, David, you mentioned you're going to have families drop the kids off at camp. Is anyone using bus transportation to get up to their sites at all this year, or no? All right, good to know.
Bernie,
We've
I will
talked about
say-
busing. Oh, sorry.
No, go ahead. Go ahead.
Oh, just we've talked about busing. We're having a real hard time in our area just with the availability of buses. The schools can't even get enough bus drivers to drive the kids to school. So that's one of our main barriers right now that we looked at was just the reliability of having transportation. We are hesitant to commit to families if we can't know that we're going to have them.
Yeah, we medical staff was sort of, they understood sort of what our thing's going to be with transportation. Their suggestion was, hey, if we're able to we have a busing company that works with us for years, if we can get additional buses just so that we can space things out a bit more. So we're looking at both options, and we're going to put the option of just direct transportation to the campsite to have them drop off. And yeah, Jennifer, if you got any connections, by all means, shoot that over. We'll put that into play pretty quickly. Thank you.
Our medical team, we looked at getting more buses too and trying to space people out, but we found that because we're taking kids from different regions of the state and they're going to be, cohorting one way on a bus and then cohorting differently when they get to camp, we just were like, that's too much mingling and mixing before we even start to feel comfortable. And so that's why we kind of mitigated, and we're just like, if there's an extenuating circumstance, it's a single mom that can't do it, whatever, but our camp starts on Friday and ends on Sunday. So we were kind of like, or other way around. Sorry, David. Other way around, still weekend-ish days. So we felt like it was a fair ask. But I do have a question for you guys that are asking families to drive. If there is extenuating circumstances, are you guys sending like a camp person down with a camp vehicle to pick up kids, or are you Ubering? Like, I've heard different ways that people are kind of helping maybe a handful of kids that can't make it on their own. So what are you guys thinking in order to transport those handful?
So we did a single day event last fall, and we extended our age range. So we included up to 19-year-olds for those who graduated during the virtual years. And we did have one who lived a state away and couldn't drive herself, couldn't get a ride. So we did hire an Uber through through my app, but she was 18. I don't know that we would have still offered the same thing if they were a minor.
Our trip is about 3.5 hours, so it will be an issue for some of our families. We put a question on the application that if, that there was no bus transportation, and if it would be a significant hardship, please explain, and give us an idea of what it is. And we just threw out some ideas. Some people will find it as a financial hardship because, and by then, who knows what gas prices will be. So we are going to be looking for donations of gas cards. And if we have a situation where, we really want to try to help a child get to camp, there's lots of things you could possibly do, help a family rent a car for a day. If we're going to look at it as possible donors, to sponsor something like that. And we'll know by May 1st who, what families are in that situation and how we might be able to handle it case by case.
We've been we've been offering gas cards to our families since like the beginning for like 10 years now, because our day camps that we've always offered are like on the coast. So some of our families were driving 3 or 4 hours, but we've never been able to offer our own transportation. So we find that gas cards at least help. We have had families come in a taxi or an Uber or things like that with a parent with the camper, and then we just cover that bill. And then we've had situations like where maybe I'll get reached out to by a family and they ask, is there anybody coming from my area? And so we kind of help connect families. I'll look and see like who else is coming from that area. And I send out a little email if you're willing to help a family, get their camper. And it actually worked out really well. Like we had some campers, a couple campers carpool, and then they get to know each other, and they, it's kind of families helping families. We just don't have the capacity. We're not quite big enough really to like make it worth our while to have the whole transportation, but we try to get rid of those barriers. But when they're not financial barriers, when they're like access to a vehicle, that's when it gets really tricky. And scheduling and stuff too can make that hard.
Aaron, when you do gas cards, like what amount do you typically do that in, or does it differ by family?
That's a really, am I muted? No. That's a really good question. We usually do $25, and sometimes kind of like if they're coming from farther away, kind of just base it on not science. It's definitely like how do we feel? What kind of do we feel like this family, could use? We also do hotel stipends like for our day camps, because they would have to come down to Charleston, drop their kid off Monday morning, pick them up Monday afternoon, drop them off again Tuesday morning, pick them up Tuesday afternoon. So if they're driving, they have to stay in town, and Charleston's really expensive. So we basically ask all of our families who's going to be staying in a hotel, and would you want any financial assistance with that cost? And we have a budget for that, and we just divide it evenly among the families who said they want help. And that's literally just a check at camp registration. We just hand them a check for that. So it's just little things, but we can't cover it all, but we try to help with what we can.
We've partnered with a very small, like locally owned gas station in a very small town that's kind of closest to our camp. And we have just sort of run a tab. So when they check in, when they leave, they get this little coupon that has our name on it. And then they get, I can't remember how many gallons we've done, but essentially they just can fill up their tank. And then we just get the bill at the end. We've done gas cards too, but that's a way just to support the local gas station that we all fill our cards on when we drive in and out of camp too. But and they just keep a tab because they're just so it's like a mom and pop shop. So
that's great. Okay, so kind of switching gears, are your camps considering bubbling, or do your camps think that you'll allow outside visitors to come in during your camp weeks?
I can tell you that with our camp, we are pushing very hard to not allow anyone to come onto camp property other than our staff, the campers, and the camp property, because we rent out a camp property. They're folks who have told us that they will be staying away from our areas, and our kids aren't doing any programming or anything for us. And we are letting our staff know, because typically in the past, people are coming up for 2 days and then having to leave, and then they come back maybe for the next weekend. Or once somebody comes to camp, you're at camp, and if you leave, you're not coming back. And we will not be bringing outside groups onto camp like we've done in the past as well to help out with various things. So it's going to be a very, for lack of a better way of putting it, isolated camp where we're in our own bubble. Once you're on camp property, you are there. And we won't be leaving camp property throughout the week either.
So it's pretty much the same that we're doing. One, I think we're going to do COVID testing every day for all of our campers and all of our volunteers. And as someone mentioned, we will test the parents and the campers when they first arrive. If anyone has COVID or anything of that nature, like they'll have to go home. But we are limiting the number of day volunteers that we have. So a lot of our regular overnight volunteers are just going to be pulling double duties with arts and crafts or just whatever, serving in the kitchen, which we typically have more than enough overnight volunteers anyway to assist with that. But we will not be allowing volunteers to just come in on a daily basis and to come and go. Once you're there, you're there. If you leave, you don't come back. So it's pretty much what we're thinking.
We're a little unique in the fact that we don't own our site, so we have to work very closely with our sort of partner organizations that we're renting from. So our medical staff and leadership is just having a lot more in-depth conversations with the sites, making sure that we're all on the same page of what their parameters are and what ours are, and making sure that we're going to lean towards whatever the most stringent one is, which is usually going to be our medical staff. So that's kind of the driving force. The overnight ones, we don't have a lot of groups that come in from outside, unless we really need them to. So we should sort of be bubbled there. Day camp's always sort of a different one. We're going to try and limit the amount of outside groups coming in. But if we do have a group coming in, we're going to be very, our protocols are going to be pretty sort of set in terms of what we need them to show in terms of their PCR tested negative. They've taken tests the day before and the day of, and make sure that it's as safe as possibly can be done. And if there's any sort of question, then we're just going to err on the side of safety and to say, no, it's not going to happen. So just sort of figure it out from there.
Because we are, a little bit different being in the city. We are going out on trips, even though we are trying to keep that bubble. So, which is why we're doing the constant tests. That's the plan right now. As far as guests, though, we made that very clear to our board, and that we're really not expecting any guests coming in, except we do a beach day event, and it's really early before the public's out there. And we have the fire department actually comes out and is our lifeguards. So we think maybe that'd be the only day that we could invite like donors and visitors to see what we do, but they would have to be like behind this line because it's outdoors. And that was like the best case scenario, where if it's an outdoor event and there is that distance, especially if it's nice and breezy that day, we should be fairly safe. So it's the should be. It's waiting to see what happens with should be.
We completely operated in the bubble last year, and I can't even tell you how nice it was to not have to worry about donor day or what time the magician's coming or getting the inflatable guy or the DJs over there driving across the grass. So that was one of those things that we looked at. This year, we haven't decided if we're operating in a bubble. I doubt it, because last year our staff was here for 9 weeks straight, and I think if I did that, I wouldn't have any staff for this summer. They would all riot and leave. But it's definitely something that we stripped, having all these vendors and all these special events. Our kids never one time asked for it last year, and it was like no difference in the fun that they had. So going forward, I think keeping it simple is something that we learned from last year. I'm also interested to learn, has anyone's state given any updated guidance for the summer yet? Because last year, New Jersey didn't release their summer camp guidance until late May, which was a disaster. And it was kind of one of the more stringent states in the country. However, this year we already learned that New Jersey just dropped everything for camp. So if we wanted to, we could have a totally 100% 2019 camp. Obviously we're not going to, but just wanted to see if anyone has gotten any sort of procedures or policies from their states yet, or up in Canada.
Nothing from Massachusetts.
Yeah, I figured that wouldn't be coming out too quick.
California tends to run based on what they do with the California Department of Education. So the governor just, dropped the stuff for mass after the kids come back from spring break. So as we're working with medical staff, one of the things that we're going to be tracking very closely is what the incidence rates are after spring break. because it'll be sort of a litmus test of like, I told you so. This is what happens when, everyone goes sideways. So it'll either be that, or we'll see by some miracle maybe it's manageable, and that'll then dictate sort of what some of the decisions are during the summer. So next couple of weeks will be pretty telling in terms of what we're seeing within California.
So Bernie brought up a good segue there, masking. Has anyone kind of decided what they're doing with their masking policies this year?
We're going with the plan A, B, and C. So plan A, which is the one that we're assuming we're going to go with, is everyone's masked on site the whole time. So it's just not even a question. That way everyone knows right from the onset of sort of what our expectations are. If things get relaxed a little bit, it'll really be up to med staff in terms of certain times or frames where it's safe, where they can do it similar to what we're going to see in our school system, so that it's not too much of a shock to families, because they'll already be used to sort of the way the system is, or the education system's running it. And then plan C, we don't see that coming back into place of just like the what normal was back before. Those days are gone, at least for us.
Fortunately for us, we're actually moving to a new camp property this year as well. Same general area, but a new camp property. And almost everything that we do there, including our dining hall, is outside. It's covered, but there's no walls or anything. So it's outside. All of our activities, we have wonderful porches on the cabins that are huge, and lots of space for us to do almost everything we do outside. Now, when they're in, let's say, the med lodge, or if they're in one of the spaces that we have for like a cooking class or something like that, they'll need to be masked. But when we're outside, we're not planning on having folks mask when they're outside. And fortunately, like 90 to 95% of what we'll do this summer will be outside.
Yeah, over at Okaizu, our policy right now is going to be masks all the time. We kind of have a disclaimer on every page on our website, and in everything we send out, saying this is what vaccinations will need to be. This is what we'll be doing with masks, and we're updating that as our medical team sees fit. We are for the first time traveling for camps this year, and we will be doing 5 in-person camps, 2 virtual camps, all at different sites. So a lot of our protocols are going to be pretty strict with the COVID, with vaccines and with masking, just because we're moving all over all the time. But yeah, masks all the time for us, in close proximity, and indoors. And I think the only time we will probably be having masks off, or we'll be in like a cohort setting, like within the cabin groups. But that is camp director question, and I haven't spoke with her on that yet, so don't quote me.
We're currently looking at fully masked whenever we're indoors as well. Yet that is more than half our day. So besides dining and cabin time. And my biggest question, actually, maybe this is a good question for the group, but it's really on a medical end. I'm like, oh, so what does it matter if our pods are constantly together if they're unmasked in the same area? Because then we're gonna have all the pods together in the dining hall, and it's all indoors. So I have lots of hard questions for the medical. I don't have any good answers yet on how they figure this all out, but I follow whatever they tell us. Masked on the buses as well, and the only time we would probably be okay unmasked is if we're, again, outdoors in an area that's really, safe distance away from others. So that's our mask policy right now.
So I'm interested to hear kind of how, if you've opened up registration, how your registration and enrollment is going. So I know for us, it is going slower than it ever has in our history. And we think it's a lot to do with the fact that we opened last year and we were so strict with all of our policies and everybody had a great time, but it was very mentally taxing. And I think kind of our parents are waiting to see, is it going to be as locked down as it was last year? Is it going to be a little bit more like normal camp? And I think we'll be announcing our policies in April and hopefully we'll see an uptick in registration, but for now, way down until we kind of announce more things.
Our camp is actually the opposite. Since we haven't run an in-person program formally in 2 years, they are dragging to get in. I mean, I did put out the application earlier this year. I put it out February 1st this year, and I began sending initial acceptances, and we usually have about 64 families in, and we got a good 85 applications. So I think it's just the fact that we haven't run programming, so they don't have any expectations really to go off of, other than we're not running something virtual and they want to bang down the door kind of deal.
Yeah, we are, my cat's tail, sorry. We just opened our registration for our day camp to the public today, and it's been open for returners for like a priority registration for a week. And we're noticing that the returners excuse me, are not signing up as fast as new families. We did a holiday gift program for 2 years starting in 2020, and it reached a ton of families that had never heard of us before. So for 2 years, we've kind of forged this relationship through email where we're just giving their kids free presents, and now they're really eager to sign up for camp, but the returners are kind of trickling in a lot slower.
I actually can go off of that as well. We usually have a good waiting list of people who've been for their 2 sessions and are just waiting for a call for a cancellation. I only have about 15 of those. Before COVID, it was probably like 30. So it's interesting that you say that.
I'm curious, to those that are doing the registration, are you seeing newly diagnosed families being registered?
Yes.
Our medical team is only allowing those in maintenance or out of treatment. We're not taking any active kids. So they have to be on oral chemo kind of at the end of their treatment. And same for siblings too. We're not taking any siblings that have a sibling or parent in active treatment at home.
We opened up enrollment, I want to say 2 weeks ago, maybe 3. And we have a total of 143 campers signed up for our summer programs. We do siblings and patients. I think there are more siblings signed up. I was just looking at our ultra camp, but I don't remember which one it was. And then we also do 6 family camps throughout the year. And we have 28 families signed up for those so far. In the first week or 2, everything was pretty much like everyone was signing up right away. We have kind of like flatlined in that area, but we also haven't advertised as much that our applications were open because we were waiting for site confirmations and family camp confirmations and just to see where things were going. But 143 sounds about normal for this time. We usually back pre-2020 would serve probably about 100 kids a week for 7 weeks. So we serve roughly 800 plus because it was 100 give or take each week. And yeah, so our numbers are kind of lower than we would think, but high for just being open.
I have a separate question, Ryan, if that's okay. That kind of
please.
dovetails on that. For anybody, it sounds like some camps who either did camps last year or are currently have their registrations open are limiting the number of campers that you're serving this year or even last year. I guess my question, we're actually limiting specifically our sibling camp by about 1/3 of what it typically will be this year, again, for safety and moving to a new property and all those types of considerations. Are you seeing any pushback from families that, you know, that they potentially won't be able to send their child to camp this year because of a limited number that's different from what it may have usually been, if that makes sense.
I think we're going to see a long wait list, and we usually take about 245, and we're going to limit to about 125. And so it's significant, but because we're offering virtual camp, and of course it's not the same, but it is an offering, and it'll be self-selected activities, whereas with cohorts, this is going to change our senior camp quite a bit. We had self-selected activities for our programming. So I think we have choices. But yeah, I think, certainly there will most likely be some families who aren't going to be able to attend this year, but the priority would be to run the safest camp that we can and to keep the numbers small in the cabins, I think.
Thank you.
We are limiting sizes at Okaizu this year, but not by choice, I would say. A lot of the different campsites have just different regulations, and a lot of them just have smaller capacities that they can hold. So we haven't really gotten any pushback from families yet. Our staff, we are requiring lower numbers of staff because we have lower numbers of kids, and we just are trying to get as many kids as we can with the right staff ratio. So we can also just pack our kids in, but also have them supervised. So I think with our staff, it's been harder to let them know hey, you can't do all 7 weeks in a row. You have to take some time, or you have to give spaces to new people. And it's just with the rental sites that we have, not all of them can accommodate so many staffers and so many campers. So we've had to limit on that end. But we also do have our weeks have different names. So it's usually a Oncology 1, SIBS 1, and most campers who've returned for many years have always gone to a certain week. So I always go to SIBS 3. I always go to Oncology 1. So because we're only doing 5 camps this year, it's kind of, they're trying to figure out where they're going and which week works for them and which site works best for them. So we will definitely have to have a wait list for different times and different camps. And hopefully we don't get any pushback, but we'll see how it goes as applications keep going.
Thanks, Knuckles. By the way, great name.
Thank you.
Has anyone had any difficulty getting staff or volunteers? We just opened and I thought the applications would be flooding through, and it's been a very slow trickle. So I've been
slowly. I say that we still cannot find a camp chef or nurse, and those are that one of the 2 vital positions you need to run a camp. But definitely it's a slow process, and I finally have at least 3 counselors hired, but I think it's just people are in a weird place, and I don't think people are in for the summer search yet. I really don't, based on what I'm getting right now.
Yeah, we've got our volunteer app has been open for a little bit, so we're a little probably behind of where we usually are, but the feedback that we're getting is just people are either they just haven't wrapped their head around oh yeah, it's time to go back to camp. They're sort of still in this fog of oh man, well, let me know if it's really gonna go, if it's really gonna happen, and then I'll wait until the very last minute to put it in, and we're hey, that doesn't help us. That's gonna be a bit problematic. And people are trying to, they're sort of, you're right. It's just a weird place that they're in. They're trying to figure out what they're doing. So we're going to do a lot more, phone calls and outreach from peer counselor, just hey, we just need to know one way or the other, in or out. like let us know, because we can't plan if it's a maybe. Maybes aren't going to cut it, because now we're getting too close to the session. So like we're cool if you can't make it or if you're not there yet, that's fine. Just give us a heads up so we can plan accordingly. And if we need to do a big push on new counselors, then that's what we'll do. And I think a lot more of the one-on-one sort of ask is definitely bringing people in, because they're realizing, hey, we're serious. Like we're back. So be ready. It's up to you now. Are you in or are you out? But no straddling the fence on this one, because you're gonna have to basically get up to speed on what all of our expectations are as a camp system, so that it's not gonna be like years before. It's a new normal. This is what we've got for the next this year and maybe next year, and just either you're okay with that or you're not. So it's we're seeing a little bit of a hold up on it, but all the feedback that we've gotten is people are excited and they want to come back, but it's just something's holding them back from just jumping in and putting it in and finishing the application and stuff like that.
I will say, to follow up on something Bernard just said as well, we're a little late to the ball game here, and I say that because of all the changes that we've had over the last couple of months. But one of the first things that we did, I went through and pulled every single cabin counselor and program staff, medical staff, whatnot, from our last 3 in-person camps. So 2017, 18, and 19. And we pulled all the contact information, and our new leadership team, we kind of split that up, and everybody personally called every single one of those individuals to let them know, hey, camp is going to be back this year. These are the dates. These are our expectations, meaning you have to be vaccinated. You're going to have to stay the entire time. You can't come and go once you come to kind of laying out those what our basic expectations are going to be, and kind of finding out, hey, where's your head at? Are you still interested in being involved with camp moving forward, and especially this year? And if not, great, thanks, just like Bernard was saying. But kind of finding out where folks' heads are. And I'm hopeful once we actually get our application up and running, hopefully here in the next couple of weeks, that those folks who have said, oh yeah, definitely I want to come, will put in their applications, and we start filling it out that way. But I think doing that front end work will for us be very, very helpful.
Yeah, I think to dovetail on to David's point, like we're finding out in some of the conversations that there's going to be much more of a mental health component, even for our volunteers too. They're just like, look, we get it. Everyone's been stuck. So we're actually looking at, we've got some conversations with some partner groups that focus on mental health. We're like, hey, look, if you're not up to it, or there are things that are you're getting stuck in, maybe we come up with some ancillary programming just for you volunteers to, see where everyone's going, where you feel comfortable, but as us as an organization, to make sure that we're being cognizant of that and making sure that we're not pressuring anyone into it. We're just saying, hey, look, here's the opportunity. We'd love to have you, but if you can't, that's okay. And if something's holding you up, if you're, we care about you as the individual, so let us know, and then we can come up with the same things that we do at camp, of just like, hey, let's offer you the peer support that you need to make sure that you're sort of getting back into that space that you feel comfortable in.
For the first time this year, I am instituting a wait list a lot sooner than I have in the past. In the past, it was like, we can take up to this many kids per session, and I just let all the kids sign up and just magically hoped that the volunteers would arrive in the right number. And last year was our first year of overnight camp, so I learned some lessons, but also I just learned we had a lot more counselors back out than in past years. I always planned for some of that, but it was significantly more last summer, and that really put us in a bind where I didn't feel like the campers had as successful a time as I wanted them to. So I already warned the parents. I was like, listen, if you get a wait list notification, it doesn't mean all hope is lost. I'm not going to take more kids until I have committed counselors for them. And I've spent so much more time on Zoom and phone calls with past volunteers in the past 3 months than I have in the past 8 years, just trying to how are you? What has been going on? How can we help you? And how do you want to be involved going forward? And I probably should have been doing that a lot more before all of this happened. So it's a good kind of kick in the butt, but also we've just recognized we have to take care of them the same way you were saying, David.
And I'll just jump in here real quick and say our numbers are lower for our campers. And we then are also scaling back on the amount of volunteers that we need. We are a smaller camp. We have our max will be 30 kids for our patient camp and 30 for our sibling camp, running at the same time. Yet the last 2 years, having the amount of virtual counselors coming in from the child life world. And I was telling Ryan earlier, like it's been pretty awesome. There are some online child life group resources out there, and you need to know someone in the child life world to put it on their Facebook group. Yet on the 30th, before we are virtual session, I'm actually speaking to Belinda Hamilton about their on their child life online group. And I've talked about other COCA camps, and they're all over the country, and these folks need hours, so they're less likely to back out on you, and they come in with the child development stuff already there, and it's amazing. And we've been very blessed. So I encourage you all, if you need like more contact, just let me know, and I'll be like, and this camp needs some people, and these can't be, because child life people are been some of our best staff so far, and some of those that haven't shown up for virtual, and they're like, oh, maybe we'll come back. I feel bad for, like, we may not need you, we want people who want to be here. So
Awesome. All right. So we are at 9 o'clock.
May I just say, one of
Please,
the,
yeah.
I had the privilege of participating in the medical director to medical director. I am not medical, but since no one else was participating, I thought some ears are better than no ears. And one of the things that I'm sorry, I don't remember the speaker's name, but they had such a difficult time finding medical staff, of course, for additional testing and all the kinds of things that they needed, that her suggestion was find your medical staff first and then determine how many campers you can take, because otherwise you kind of get the horse before so that's just what I'm sharing from what I learned from there. So there's my 10 cents.
That's great. Thank you for that call back, Gail. It's also our medical director to medical director town hall recording is available on Outside the Box if you wanted to go back. Another shameless plug. I'll do it all night long. So we're at the top of the hour. I really can't thank you all enough for being on. I mean, that was like the best conversation we could have ever had. So thank you all. And hopefully we'll see you next week on our COVID-19 outcomes for children with cancer town hall, and keep looking out, because I think around in May at some point we'll do something similar where we'll do this again and we can all kind of talk through our policies as we get to know them even more by then. But thank you all so much for your input tonight. We really, really appreciate it.
Great discussion. Thank you.
Thank you for having it.
Thank you. Nice meeting you all.
good night, y'all.
Good luck, David.
Thank you.
Yeah, let us know
Bye-bye.
how we can help you.
Will do. Thank you all. Bye-bye.
Do me later.
I like Jason's little golden retriever puppy.